Greeting from Trishla Foundation. All of you are welcome to our YouTube channel of Trishla Foundation. This channel is meant to make increase awareness about the cerebral palsy and increase the knowledge of our parents, our social worker, our specialists who are dealing with these children and adults with cerebral palsy. We have started the webinar on effect of aging on adult with cerebral palsy. That is very rare information you can get other places, because every children who are affected with cerebral palsy are going to be adults in some years. So their parents, they themselves should know whatever problem is going to come, because aging is going to affect even in normal individuals. In cerebral palsy, because of lots of other problem is there, then lots of other problem can develop. If they can know, they can manage beautifully, they can prevent it, they can treat it. In last lecture, we have taken the impact of physical disability on cerebral palsy adults. In that, also I have talked about the osteoporosis and osteomalacia. In this lecture, I am talking about the incidence of the pain in adult with cerebral palsy. Why is the pain they feel more? Pain is very common in lifetime experience of living with cerebral palsy with prevalence of over 80%. That means 80% of adults with cerebral palsy can have pain in any time in the lifetime. Where this pain can occur? Pain can occur in the back, in the neck, in the hip, in the knee and foot. They are the common side. Why they can have a pain? Pain can occur because of muscle spasm, arthritis of the joint, vitamin D osteoporosis, vitamin D deficiency and osteoporosis, fracture, dental problems, jaw problem, pressure sore, feeding difficulty, gastric reflex, constipation and improper bracing. Lots more other causes there, but these are the very common causes there. How you can treat it? First of all, we have to take detailed history. We should know what is the cause, how it occurs, what are the body part affected, that's why you have the pain. The individual with cerebral palsy, they should consult proper physician, orthopedic surgeon and specific problem related consultation from the medical specialist. After the proper history and examination, where it is happening, proper investigation is required. We need to treat of the cause, why it occur, where it occur. If there is physical muscle problem, then they can take analgesics, they can take rest, heat application. In chronic low grade pain, if there is sudden acute pain because of injury, they can take ice fermentation and bracing should be corrected. So proper evaluation of the origin, of the cause, where it occur, that should be done prior to any treatments. One most important cause of the pain is osteoarthritis, and osteoarthritis occur because of the breakdown in the cartilage, wear and tear of joint surface and loss of joint function. It happens also because of the abnormal loading on the joints that causes early onset osteoarthritis in cerebral palsy. In cerebral palsy also, the spasm of the different group of the muscle that can cause increased pressure of the joint, increased load on the joint, that can lead to pain. And most common site of osteoarthritis is the knee, hip, ankle and back. As per incidence is concerned, as per literature is saying that osteoarthritis is common in 27% of individuals between the age of 15 to 25 years, as compared to the 4% of general population. That is very high incidence in cerebral palsy. It could happen because of high demand of the work and increased load on the joints. And 59% of cerebral palsy between the 16 to 84 of age, they can have the osteoarthritis. That means osteoarthritis chances are higher in cerebral palsy compared to the normal population for each age groups. Why it happened? I have already told you that increased pressure on the joint, It happened because of the altered muscle activity in spasticity, jerky movement of the dystonia, co-contraction of the muscle from front, from back of the joint, just like the quadriceps, and hamstring muscle co-contraction in the knee joints, mechanical alignment, just like the torsal abnormality of the joint, valgus knee, bowing of the tibia, abnormal loading because they have imbalance, that improper pelvic control, restricted range of motion can also cause the osteoarthritis. It happened because of joint incongruity, reduced contact pressure at the joint, creating the thinner cartilage and osteopenia. And thinner cartilage, which is covering of the joint surface, degenerate early. Subcondylar bone loss will occur and ultimately lead to the mechanical destruction of the remaining cartilage. So, it is very important to know it, prevent it. Prevention is always better than the treatment. It goes side by side to the treatments. And most of the CP associated etiology of osteoarthritis is modifiable. How you can modify? Weight maintenance. Cerebral palsy individuals should have minimal weight as per their ideal height and age is concerned. Obesity and overweight is much more concerning for the cerebral palsy, even in ambulatory capability, even for the osteoarthritis. Avoidance of abnormal forces by the use of walking assisted devices. If the individual who are not able to walk independently in the society, they should use walking assisted devices that will enhance their activity, that increase their confidence, they will decrease the pressure on the joint, and the history of the recurrent fall will decrease and there is lesser chances of the fracture will be there. Exercise to enhance the range of movement of the joints. Modification of the activity. If they are not able to perform activity, they have to modify their activity with sitting, with some support, whatever they have. Every joint mechanical malalignment is there, joint muscle co-contraction is there, the torsal abnormality is there, that should be managed by the different surgical methods. Now come to the treatment of the osteoarthritis. Primary treatment is analgesic and other medicine. Exercises as per guidance by the physiotherapist. Weight reduction, diet maintenance, use of walking assisted devices, and all the cerebral palsy individual should not allow to sit on the ground in the Indian toilet position. They should use commode. Modification in activity should be done. If the osteoarthritis is very severe, that is not manageable with the medicine and exercises, then they will need joint replacement. An exercise that I have given the chart is in Hindi, but this exercise photograph is there, you can go through. You can also go through the video, link is there, and you can have the know what kind of exercises you can do for the knee pain. Now come to the topic of sarcopenia and physical stamina. The overall muscle reserve is very less in cerebral palsy individuals. With age, the muscle mass will going to decrease. There will be more chances of chronic fatigue and increase in the muscle weakness, and chances of recurrence fall is very common. For maintaining the stamina and muscle recruitment, we have to very important to do regular and daily basis exercises that strengthen the muscle. Aerobic exercises, gym, sport, regular physical activity, yoga, walking, cycling, everything can maintain the muscle mass. Along with this exercises protocol, we should take high protein supplement, less carbohydrate intake, so that fat should not replace the muscles. The real value of strengthening program in cerebral palsy may be in the improvement of the muscular reserve in short term, but in long term, they can maintenance of muscle mass above the critical threshold in long term run. So, it is very important to maintain the muscle mass by the strengthening exercises. As you know, that lots of population and cerebral palsy individuals are doing only joint range movement. That is not going to help in the building the muscle. Function and mobility of adult with cerebral palsy may be extended by progressive resistive training under the guidance of physical therapist. The most effective method of extending mobility adulthood may be to develop a significant muscular reserve in childhood and adolescence as bone reserve, peak bone mass. So childhood and adolescent, the muscle reserve should be maintained and increased by giving the good stimulus, by doing the strength training stretching exercises, and muscle may be more adaptable to mechanical stimulus in adolescent. So adolescent and children is very important phase for adult with cerebral palsy. And lastly, I want to say that preservation in place of improvement is goal of therapy in the adult. We need to preserve the functional capability, muscle strength, stamina, bone quality, general health, quality of life. We have to prevent all the complication which is going to happen. We have to maintain the weight, we have to take good protein intake, and what any problem you are getting, you need to consult orthopedic surgeon who know about cerebral palsy, or pediatric orthopedic surgeon, any specialist who have knowledge about the cerebral palsy. In last, I want to say that we have uploaded lots of video on our YouTube channel. That is very, very important for every children, their parents, the individuals. They can take the information, they can prepare their life for beautiful ahead to the lives. You should subscribe the channel. You can also help other to subscribe the channel, get the lot of information. We will upload the lots more video on knowledgeful update of you, so that you can have good quality of life in the future. Thank you.